This week, the local chapter of United Healthcare Workers East, which represents employees at the hospitals in Ogdensburg and Carthage, made a sort of cry for help. They wrote a letter to the state health department urging it to intervene to stabilize their employer, North Star Health Alliance, which runs the hospitals. It calls for action by, quote, any means necessary, including receivership, where another healthcare entity would take over. We look inside what's going on at North Star on today's Story of the Day.
Support for Story of the Day comes from Long Run Wealth, an SEC-registered investment advisor in Lake Placid, providing comprehensive wealth management, retirement, and financial planning solutions. LongRunWealth.com. And the Devlin Inn and Suites, Lake Placid, welcoming families, athletes, and groups to the Olympic Village, offering Adirondack mountain views and dog-friendly accommodations. TheDevlinNY.com.
Hey, I'm David Sommerstein. It's Wednesday, February 4th. First up, nearly 70 skiers were trapped in gondolas at Gore Mountain earlier today. Governor Kathy Hochul broke the news at a press conference this morning.
This is a situation we're taking very seriously, and the rescue teams are on the ground trying to restore the power, but also to extract people from this frightening situation. So we're going to be watching this very closely.
That was Hochul speaking earlier this morning. Later this afternoon, a spokesperson from the Olympic Regional Development Authority said no injuries had been reported at Gore, which it manages at North Creek. According to ORDA, staff at Gore shut the gondola down as a precaution after discovering a mechanical alignment issue with the lift. Forest rangers and other rescue teams were on the scene to help rescue the 67 skiers stuck in the gondolas. A Siena poll released yesterday shows Governor Hochul maintains a commanding lead over Republican Nassau County Executive Bruce Blakeman for this year's governor's race. The poll finds Hochul leads Blakeman 54 to 28%, with little changing from December's poll. The survey also found Hochul has a dominant primary lead over Lieutenant Governor Antonio Delgado. And Hochul's approval rating is up to its highest level, 49% compared to 40% who disapprove of her performance as governor. Some of Hochul's State of the State proposals are polling above 50% support, including eliminating state income tax for tip earners up to $25,000 and increasing child care funding by $1.7 billion. It's been a bad start to 2026 for North Star Health Alliance, which runs the hospitals in Carthage and Ogdensburg, both critical to their communities. The CEO resigned just days after laying off more than 100 people. North Star has blamed its financial instability on the state, withholding promised grant money. But the state says North Star has failed to provide basic information about itself and how money it's already gotten from the state has been used. Amy Feiereisel reports on where the healthcare group currently stands and what the state wants and why.
Rural hospitals in New York receive state support in lots of different ways. There's Medicaid and Medicare funding and reimbursements, grants for infrastructure and equipment. And then there's the state's Vital Access Provider Assurance Program. That's a pool of state funding for hospitals in need. It's considered discretionary because there isn't a competitive grant process.
This is money that's really specifically put towards helping a hospital that's in crisis.
Allie Coates is a professor of healthcare management at Clarkson University. She also serves as president of the board of directors of the New York State Association for Rural Health.
The point of it is to rescue a hospital or to help it make a very important needed change to be able to sustain its operations.
The North Star Health Alliance, which runs Carthage Area Hospital and Claxton Hepburn and Ogdensburg, is in the second camp. It asked for vital access funding as it transitioned Claxton Hepburn into a critical access hospital and a behavioral health hospital. That complicated change has been in the works since 2022 in partnership with the state. But the vital access funding comes with strings attached, says Coates.
This is not propose an idea and get money for it. This is really an agreement to partner with the state to share a whole bunch of information so that the state can make sure that the money is used to support the continued existence of that hospital.
That sharing of information is at the heart of the current stalemate between the North Star Health Alliance and the State Department of Health. North Star officials say they've provided the information requested of them and acted in good faith all along. The state says something different, that North Star has refused to provide basic information about itself and how previous funding was used. According to the Department of Health, that includes audited financial statements from 2024, salary information for top earners, and an accounting of intercompany transfers. That information isn't optional with Vital Access funding, says Coates.
The state, by law, has to require a whole bunch of different types of paperwork, types of forms. You have to agree to share a lot of information in real time with the state.
Absent that information, the state started withholding funding. In early December, the North Star Health Alliance announced it was on the brink of closure. Since then, it struggled to make payroll. On January 19th, the healthcare group announced layoffs of about 120 staff, including providers at rural health clinics in Madrid, Waddington, Hammond, and Morristown. Just days later, North Star's CEO, Richard Duval, resigned. This is having a big impact on communities that rely on care from North Star, like Carthage and Ogdensburg. Ogdensburg Mayor Mike Tooley says people are scared about more layoffs and about access to the healthcare services they rely on.
We have people who have learned that the doctors they've been seeing have been let go by the hospital. These are people who may have been working with these doctors for years and years. It just adds a lot of stress on the healthcare needs of the citizens.
Tooley says the hospital is also a major employer in the area. This will have economic impacts. He says that's why the Ogdensburg City Council adopted a resolution urging the North Star Health Alliance and the Department of Health to move forward.
And hopefully the hospital can provide the information in the format requested by the Department of Health so that they will be satisfied and will release the funds that they have pledged to provide the hospital.
After the initial announcement of financial instability, North Star Health Alliance officials have said very little. When the CEO resigned, the group offered no direct explanation for the move. The State Department of Health has also remained mostly mum, directing requests for comment back to North Star. State Assemblyman Scott Gray, who has been in talks with officials from both parties, told NCPR that post-Duval's resignation, the state is working to, quote, establish interim management and a management oversight team at North Star. There are a couple different avenues that could take, potentially a state-run triage team or a receivership where another healthcare group would take over operations. Allie Coates, the rural health systems professor, says it's in no one's interest to see the hospitals in Carthage or Ogdensburg shutter. She thinks that's an unlikely ending.
There may be some change. We've definitely seen throughout the region, there's been a lot of change in the way that hospitals and health systems deliver services. I think there's likely to be some change, but it does not benefit anyone for that hospital to go away.
This Friday is another payroll day. The North Star Health Alliance said in a statement that they are, quote, continuing to manage a fluid financial situation. It said that payroll for hourly staff is secured and it's working on the remaining money for salaried employees. It also said that North Star is in close communication with the Department of Health. Amy Feiereisel, North Country Public Radio.
We have more news all the time on our website, ncpr.org. Music today by Mark Corey of Watertown and Evan Veenstra of Gananoque, Ontario. I'm David Summerstein, North Country Public Radio.